ESR is a laboratory test used to help detect inflammation in the body by measuring how fast red blood cells settle in a vertical tube over 1 hour. Before starting, make sure the work area is clean, organized, and properly disinfected. Gather all materials needed, such as the ESR rack, Westergren tube or pipette, anticoagulated blood sample, timer, PPE, and labeling materials. Always wear appropriate personal protective equipment, including gloves, lab gown, and mask if needed. This ensures safety and prevents contamination. Confirm the patient's identity using the label on specimen and laboratory request form.
So, can you please state your name? Marsha. So, your process request for today is ESR. So, I'm just going to
Check for complete details such as the patient's name, date, and time of collection. ESR testing, whole blood must be properly mixed and free from clots. A clotted or hemolyzed sample may produce inaccurate results and must be rejected. Gently mix the blood sample by inverting it several times to ensure even distribution of cells. Do not shake vigorously to avoid hemolysis. Place the ESR rack on a stable, flat surface away from vibration, heat, and direct sunlight. This is important because movement or temperature changes may affect the result. Using a pipette or the appropriate ESR filling device, aspirate the anticoagulated blood and fill the Westergren tube up to the 0 mark. Ensure there are no air bubbles, as bubbles can interfere with sedimentation. Carefully place the filled tube into the ESR rack in a perfectly vertical position. Make sure the tube is stable and not leaning, since a tilted tube can cause a falsely increased ESR. Immediately start the timer and allow the tube to stand undisturbed for 1 hour. During this time, red blood cells will gradually settle at the bottom, leaving plasma at the top. After exactly 60 minutes or 1 hour, read the ESR result by measuring the distance from the top of the plasma column down to the top of the red cell layer. Record the result in millimeters per hour. Document the ESR value clearly and accurately. After all those, dispose the used tubes, pipettes, and contaminated materials in the appropriate biohazard waste container. Follow proper infection control and laboratory waste disposal guidelines. After completing the test, disinfect the work area and return equipment to its proper storage. Always ensure correct specimen handling, accurate timing, and proper tube positioning to obtain reliable ESR results.